Hello everyone. I would like to present my research project entitled as Safety of Bottle Feeding under Nasal Respiratory Support in a Preterm Animal Model with Respiratory Impairment. So starting with the introduction, preterm infants with residual respiratory impairments or cardiorespiratory events are commonly administered on non-invasive nasal respiratory support or NRS. There are two commonly used NRS, nasal continuous positive airway pressure or nasal CPAP and high-flow nasal cannula. However, a number of NICU teams have feared that nasal CPAP or high-flow nasal cannula might disrupt the immature protective mechanisms of the lower airways of preterm infants, which can lead to increased risk of pulmonary aspiration of milk. And given the importance of oral feeding for preterm infants, our team conducted a study which previously showed that bottle feeding is safe in preterm lambs under nasal CPAP. So, we conducted our study, and the objectives of the study was to assess the safety of bottle feeding in preterm lambs under both high-flow nasal cannula and nasal CPAP without and with respiratory impairment. Then regarding our methodology, we used 15 lambs which were born 2 weeks before the full term, and each lamb was bottle fed in 4 respiratory conditions. The first condition was the control with no NRS. The second condition was nasal CPAP with 6 centimeters of water. The third condition was high-flow nasal cannula with a flow rate of 7 liters per minute. And the fourth condition was high-flow nasal cannula with CPAP effect, or it's high-flow nasal cannula with the same positive tracheal pressure as nasal CPAP. So in this condition, we used high-flow nasal cannula with 7 liters per minute, and we had the goal of controlling the air leak through at the nasal nares of the animal, so that we could have a similar positive tracheal pressure as nasal CPAP. So we did our bottle feeding recordings with and without tachypnea or respiratory impairment. So we induced a 50% increase in the baseline respiratory rate by a standardized chest compression for each animal using blood pressure cuff. All of our recordings were done under video fluoroscopy to assess safety through detecting any tracheal aspiration of milk. Then regarding our results, I'm going to present our results with lambs with tachypnea. So if we compare the 4 conditions, the control, nasal CPAP, high-flow nasal cannula, and high-flow nasal cannula with CPAP effect, regarding the safety variables in the form of number of bradycardia, minimal oxygen saturation, and the number of cough, so we could see that there is no significant difference between the 4 conditions regarding any of the safety variables, except for that the minimal oxygen saturation was a bit higher with nasal CPAP. But indeed, this was of no clinical significance. And regarding our video fluoroscopic results, so we could see that there was no tracheal aspiration detected in any of our tested conditions. So based on our results, we could conclude that bottle feeding in preterm lambs under various nasal respiratory support is safe, even in the presence of tachypnea. So finally, I would like to thank you for your attention, and I would like to give a special thanks for the members of lab of Dr. Jean-Paul Prout, and for sure, I would like to thank the funding organizations of my project.